Dr. Lee, what are the screening tests and procedures to detect ovarian cancer?
So, one of the important things to realize is that we do not actually have a screening test for ovarian cancer. And so that's really important for the general public who maybe is at average risk. Patients who have a strong family history or a genetic hereditary condition, sometimes we do use ultrasound and CA-125, but that's not considered a screening test for average risk patients. So we're very limited in that sense for ovarian cancer. There's a lot of research that's being done about this.
Have there been advances in screening or screening technology that patients should know about?
I think that, the issue with screening in ovarian cancer is because we have not had any, and there have been really large studies that have been done both in the US and in Europe, trying to see, does ultrasound work every 6 months, or does CA-125 and ultrasound work? There's some combination blood tests that have started to become a little bit more researched in terms of going further along, but there's really nothing that's like the perfect answer. One of the really important things that we talk about, though, is knowing family history to see if there's something that can be done to kind of help patients who have a family history. And then also being really aware of subtle symptoms of ovarian cancer that can trigger you going to your doctor and then really pushing and advocating for yourself or your family member to get a workup done, which can often include an exam, an ultrasound, and maybe even something like a CAT scan or CT scan if any of the symptoms are a little more worrisome.
What questions should patients ask their doctor about detection?
So genetic testing is very important. So when we get, for example, and I'll kind of back up a little bit to say, if somebody, I'm seeing you as an internist, but I haven't had a pelvic exam. So making sure you're seeing a gynecologist or an internist or family medicine doctor who can do a vaginal and a rectal exam is one important step. Perhaps getting an ultrasound or perhaps getting a CAT scan if the symptoms are more significant. Unfortunately, we still see a lot of women who, have these sort of vague symptoms, maybe they're GI related, and they get a workup for like 6 months on an EGD or a colonoscopy, or they try Pepsid, and all of those things are good and they're not unreasonable to do. But I think something else that can be done in addition would be a pelvic ultrasound, as an example. I would say that if somebody doesn't have any of those symptoms, but they have a family history, that's where we're in a little bit more of a bind as to know what the right thing to do is. We know that for patients who have a known BRCA mutation and are not ready for risk reduction surgery, we often will use ultrasound, but we know that ultrasound is not perfect.